Hello, everybody. Good morning. My name is Uri Dorchin, and on behalf of the Nazarian Center for Israel Studies, I want to welcome all of you who join us today for our event, whose title is Israeli Society and the COVID-19 Pandemic. Since this COVID-19 burst into our lives few weeks ago, or maybe even a few months ago by now, we were flooded by numerous discussions, commentaries, and interpretations that was focused mainly and naturally on the medical issues, and to lesser extent also political and economical aspects. Much less has been said about the sociological aspects of the situation. And apparently there is a good reason for that, because as we might think, the pandemic knows no borders. It does not differentiate between social sectors or segments, be it religious, ethnic, racial, or national borders. Yet we think that the sociological issue must get some attention, and we'll try to fill this void in the next hour by referring specifically to the situation in Israel. One story that I happened to hear in one of the many panels that runs these days on television, it was a panel that was focused on what may be called the history and folklore of pandemics. You know, television must fill up their time slots with different colorful story like that. And one of the panelists said that it was during the Black Death pandemic in the Middle Ages that Jews in Europe died in much smaller numbers in comparison to the rest of the European population. And he also explained that the reason for that was their custom of washing hands before getting to their sitting to have their dinner, their meals. Now, I never checked about this story, and the question if whether or not it is correct seemed less important to me. What is important is that there is a good possibility or probability this kind of explanation can be right, and the fact that habits, lifestyles, customs, and so forth may have some influence on the chances of people to actually get infected by a pandemic. Now, as I said, we will focus on the situation in Israel. And when we talk about the sociology in Israel, we can approach sociological aspect in, well, at least two dimensions. The first dimension is the national one. If we take states to have some sort of what we call national culture, that maybe we can talk about the situation in Israel in comparison to the situation of other states and their societies. The second dimension would be the differentiation between sectors and social segments within the Israeli society itself, and once again, how their different lifestyles or habits may affect their position or the situation in the context of the pandemic. Now, in order to do so, we summon two sociologists that were with us today. The first is Professor Gad Yair. Professor Yair is a faculty in the Department of Sociology and Anthropology in the Hebrew University in Jerusalem, where he also served as the chair of the department until a few years ago. Currently, Professor Yair is the Israel Institute visiting professor at the Sloan School of Business at the Massachusetts Institute of Technology, MIT, and he joins us this morning from Boston. Thank you for joining us, Gad. Professor Yair published 7 books and more than 90 papers, many of which revolve around the Israeli culture, education, and the academia. Our next, the second presenter is Dr. Assaf Bondy. Dr. Bondi is a postdoctoral fellow at the Nazarian Center here at UCLA, and his research is focused on the political economy of labor and industrial relation systems in advanced economies. So we will hear these 2 presentations, and later on, toward the end, you guys who join us today will have the opportunity to present questions to our presenters. And now, without further ado, we will get to our first presenter, Professor Gad Yair.
So let me begin by saying that Israel, the numbers of deaths in Israel are quite miraculous. We tend to speak during the last weeks about Germany and about Sweden being exceptional countries, but actually Israel is the most exceptional, other than, I would say, Australia and New Zealand. The number of dead by the coronavirus is 10 times more in Sweden than in Israel. It's 7 times greater in the USA compared to Israel, and it's 3 times in Germany compared to Israel. The second element of the Israeli miracle, I would say, is the short period by which the society had to be closed down. As of the last 10 days, Israel is already open. Kindergartens and schools returned, university laboratories returned, libraries returned, and this is quite exceptional. And the last element I would argue is that economically, Israel is going to withstand the crisis compared to other places, other countries, in a more steadfast way. We will suffer less economically compared to other countries. And I will try to explain why the spread of the virus was cut short in a quite fast way. In Israel, we usually think of ourselves as a very militaristic society. All Israeli citizens basically have to serve in the Israeli army, and you are constantly, we refer to the Israeli military-civil relations as very unique in the sense that Israeli citizens are always part of the Israeli army, whether it's in serving in what we call miluim, or families always having someone in the army in one way or another. And Professor Baruch Kimmerling identified Israel as an interrupted system, interrupted in the sense that it's always in between wars. So the movement between war and daily life is very fast in Israel, or the move between crisis situation and normal life is very fast. And the Israeli public is trained to follow governmental regulations whenever a crisis situation occurs, and the conformity to those governmental requests are basically followed to the letter by most of the public. And indeed, as the pandemic began spreading in Israel and the Israeli government took immediate actions to close Israeli society, if you followed indicators by Google Mobility, you saw that Israel, similar in a way to Italy and similar in a way to the public in Spain, went home. When you look at American data, you see that Americans went to the parks or were much less obedient in following governmental directives to stay home. So people stayed home, and that made the pandemic much less successful in spreading because the social networks, the connections between individuals were cut short by the governmental request and the compliance by the Israeli public. So that is one element which was crucial to the success. The second element was the ability of the Israeli government to enlist the Israeli army to help communities where the spread of the virus was exceptional. Probably is the case of the city of Bnei Brak, which is an ultra-religious city with 200,000 residents, and the pandemic began spreading them there very fast. And the Israeli government sent Israeli soldiers to supply the community with food in order for families to stay home. And this ability to help the community to close the doors by having food supply routinely supplied by the army helped to curb the spread of the virus in Bnei Brak, and from there on, the waves of the spread were cut short. And the third element of what I call the Israeli miracle is another element of identity, which is you never leave a wounded soldier on the field, that you fight for every wounded person. There was a documentary running in Israel's largest hospital as the pandemic entered, and you could see the medical teams being led by the director of the hospital, which is a veteran of the Israeli army, and he motivated his team to fight day and night for every ill person, irrespective of religion, whether it's Muslim, Christian, or Jew, whether it's ultra-Orthodox or secular. And the camera followed the team for 6 weeks, and it was amazing to see how committed the medical teams were to save every life in the hospital. If you see what happens in the US, just yesterday, I think it was the New York Times, which made a story about medical staff quitting their jobs in US hospitals because there was not enough supply to protect the medical teams. And as a consequence, people, professionals began quitting in order to help their families. This is not, it was unimaginable to do in Israel because the value of life is such of importance in Jewish life and to the Israeli society in large. So taken as a whole, these three elements, which I argue relate to militarism in Israel, or the culture of militarism in Israel, helped stem the virus and keep the number of dead people at the bottom. Let me just finish off by saying that Israel is a bit larger than Massachusetts, where I live right now. And the numbers initially went along. Israel and Massachusetts were suffering to the same extent, but then something happened. Massachusetts took off in numbers, unimaginable numbers. So it's 4 times the number of Israel in terms of infections and 20 times the number of Israelis pandemic. And you stand in front of those numbers compared to Sweden, compared to Germany, compared to Massachusetts, and you really have to conclude that, whoa, Israel, there was indeed a miracle out there. Uri, you can take it.
Thank you very much, Gad. It was fascinating. It was a shame that we could not see you, but at least we heard you. Now let's jump to our next presenter, Dr. Assaf Bondy. Assaf.
Thank you very much, Uri, and thank you, Gad, for your fascinating perspective. I want to follow, to some extent, your remarks and your perspective, and Professor Yair's perspective, but turning the light to another point of view, maybe one of the political economy that, in my view, should take a prominent, important role in explaining what exactly is going on. I want to initially refer to Professor Yair's points on the conformism and the militarist culture of Israel that he very justly identified in the Israeli society, especially relatively to the American society, to claim that while cultural explanations are of crucial importance, we should not undermine the basic institutional and mainly political economic difference between the Israeli and the American society. I think that the ability or willingness of Israeli people to follow quarantine orders should be understood also in light of the confidence that they have in public systems, mainly in the public health services, as well as the relatively accessible unemployment insurance. While in the US, the relative unwillingness or even protest that we continuously seeing against state regulations and orders is to some extent due to the lack of public health system or the differentiality in the coverage of healthcare in the United States, but also on the relatively inaccessible unemployment insurance in throughout the different states comprising the United States of America. We can only give the example of Florida, in which the unemployment insurance benefits are inaccessible to an absurd level, leaving people with no choice but to get out of the house and rebel against confinement by going to find a means of subsistence. Moreover, the conformity that is seen in Professor Yair's discourse, I believe is far from uniform. Resistance and protests were seen among workers that increasingly demand fair treatment, protections, and better compensation in this period of pandemic. In the face of the crisis and its implications on the narrowing of democratic space in Israel, people nonetheless came out of their house to protest against governmental policies. Workers who were silenced for years are raising their head with ever greater power through this coronavirus crisis. Teachers, physicians in apprenticeship, and many full-laft or self-employed workers in Israel are getting out of the house, undermining state regulations in order to protest and raise their voice. In the United States, we're not seeing only the extreme right protests against state regulations. We also see food sector and delivery workers from McDonald's, from Amazon, as well as other companies that protest against the employer's lack of protection or the unsafe workplaces in which they are required to work. These workers turn their anger and frustration to activism and organize to refuse and fight against the harm they experience from their employer in times of COVID crisis and dangers. To move a little bit forward, I want to point at some of the big questions that are raised in the recent weeks concerning the revolutionary potential or fantasies, one may say, that the coronavirus crisis entails or may bring forward. Many people are asking, what are we seeing here? Will it be the end of the economy or political economy that we are used to, of capitalist mode of production? Are the service or essential workers going to be our new heroes? Or will we see a new balance of power between workers and employers? And will the state that is increasingly proven as crucial to these to cope with this crisis will create a new and wider social protection net around us civilians? Well, concerning the future, there's the famous Jewish phrase that the prophecy is only given to fools, but nonetheless, us academics can do is to look at the present and try to understand what it curtails, what the current situation tells us about changes in society or reproduction of previous patterns, and the potential implications of the coronavirus on next months and years. Looking at the present time, few months into this global pandemic and the global crisis it unleashed, one can see that the hopes or yearnings for a better society following this disaster are far from being in hand reach. My main point here is that the coronavirus crisis does not open ways for an alternative social organization yet, but rather amplifies the previous order, its structure, its trajectories, and mainly the inequalities and social divisions that were created throughout the last decades or even century. While the state does come in strongly than before in Israel, as well as in the United States, to a large surprise, its effects do very little to existing weaknesses or to social divisions and inequality. In fact, in the Israeli case, the states step up or step in, express an amplification of previous trajectories that Professor Yair already identified to us, of a special form of paternalist control. Not the welfare caring paternalism, but a more warfare, controlling, and inspecting paternalism. This mode of state interventionism undermines the need for social services and protections against the market, against sudden layoff or unemployment, in favor of states' control over citizens and limitations of their freedoms. Moreover, it risks the increase in socioeconomic inequality and the widening of gaps among different groups in society. While the number of sick and deaths and the death toll in the Israeli society is relatively low, the social economic security of Israeli workers, citizens, residents is very low in relation to other countries, to other Western developed countries like Germany, like Finland, Denmark, France, and even the United Kingdom. Looking at the labor market, this difference or trend sharpens inequality and hardens control through the pandemic. For example, some workers got furloughed. These are the weakest workers, those without union representation, those that have no workplace representation. Those are mainly women, Mizrahi and Israeli Palestinian workers that were sent home with no consultation or preliminary hearing, and had to suffer a sharp decline in incomes. They also have no security on when, where, and how, and to what extent they will get their jobs back. At house isolation or confinement, these workers experienced a dramatic decline in income, which made it harder for them to survive and sustain their existence and their families. Other workers kept their job. Some were able to work from home, but these, we should keep notice, are the relatively strong workers. Most of them are male, employed in the IT sectors, or they are the high-ranked public sector officials with relatively high incomes. Those, the other workers that kept their jobs are what we call the essential workers. Not only physicians that worked around the clock, physicians and nurses and other health sector professionals. These are the retail workers, construction workers, and also in some of the industry sectors that were required to attend their workplace, endanger their life, and were even asked to extend their work with little public inspection on protection at work from the virus, neither a wage increase. On the contrary, under the crisis emergency, government undermined, the Israeli government further undermined protection of workers and even extended the allowed work time up to 14 hours a day. These differences between workers, between different parts of the society and of the economy, and reveal the importance of state protection, but also of union protection, which in Israel is disproportionately allocated to public sector workers. In the US, we can see these divisions even sharper. Unprecedented unemployment is hurting the most unsecured workers, with some comparing this event to the Great Depression, which is very similar in levels of economic degrowth and unemployment. The dangerous price of private healthcare that is unraveled in these, through these crises is seen in the high numbers of sick and dead people that Professor Yair mentioned in Massachusetts, but also throughout the nation. The unprotected workers in the United States, in the food sectors, delivery, retail, these are the most vulnerable workers. The migrants, the undocumented, the women, young workers. These differences not only reveal the basic inequality, but also sharpen it to a large extent, therefore making these the revolutionary potential of this crisis to be undermined. In the absence of universal state-based safety net that puts citizens' welfare at first place, the self-employed, the precarious, marginal workers are among the most damaged from the crisis. Another group that experienced the coronavirus crisis in the hardest ways are the immigrant or the non-citizen workers, who are extremely exposed to harm and exploitation during this period. In Israel, as well as in parts of the United States, these workers were required to keep working and even work harder, but were left without protections. No health insurance, no safety or health measures at work, and with increased employers' control according to these quarantine regulations. In Israel, these are the non-citizen Palestinian workers in construction, the Thai workers in agriculture, as well as the East Asian workers in the home care sectors. In the United States, these are mainly Latin American workers in deliveries, as well as in the gig economy. These workers were again proven as essential workers for the national economy, but in contrast to other developed countries, they were again underprotected, discriminated, left to the grace of the free market. From this perspective, what the coronavirus crisis demonstrates is not a great miracle, but an extreme amplification of pre-existing socioeconomic inequalities or exclusionary policies on the basis of citizenship, on the basis of gender, of ethnicity, as well as of age. But also the coronavirus crisis reveals potential for resistance and challenge to previous inequality and exclusion, which lies in classic and innovative collective actions through unions as well as other organizational platforms.
Asaf, can I jump in to
please.
present a question? And this is a question that I want to take it from more or less the point where you got us to now, and kind of keep up along this trend and present a question to both of you guys. So for almost half a century now, the status of the nation state as a political and organizational framework is seen to be diminished in the face of an ever-growing extension of globalization. However, the current crisis reminds us, as you said, Asaf, of the enduring importance of the state as a regulator and a final arbiter in issues referring to the life of those who live within it, within its political and administrative domain, whether citizens or not. And here I'd like to ask two questions. I would appreciate short answers. First of all, what can we learn from this? Is there still a place for the bottom-up initiatives amid such extreme conditions? Civil society organization, NGOs, resistant groups that find a regular condition as a very comfortable condition to convey their initiatives in regular times, and now what happens to them in the time of crisis, or whether the state is the only entity or the only player on the court that can offer a viable solution for such crisis. And second, what about those social groups who does not affiliate with a nation? I'm not speaking necessarily about undocumented or illegal aliens, but those who have an official status as a state citizen, but not necessarily identify, say, with the ethos of militarism that God presented. Those who are at the margins of society. Professor Yair, let's start with you.
Okay, so indeed there is still a lot of place, a lot of room for NGOs to take initiative, at least in the Israeli case. I'm sitting on the board of a few NGOs involved in education, and we immediately saw how those NGOs accommodate to the crisis, continuing serving students in the most underprivileged sectors of the Israeli society. The only sector which the NGO eventually had difficulty getting to is Bedouins in the Negev, which have no internet connections or smart phones, but otherwise kids in the periphery of Israel, well connected and continued to get high quality educational programs throughout this crisis. And the pace by which the NGOs were able to act was much faster than the Ministry of Education, the government, could act. So yes, I think NGOs are crucial. And we do need a strong civil society, even in the context of Israel, where the state is so powerful. As to the second question about non-identifying groups in Israel, we usually speak of tribes. And two of the tribes, the ultra-Orthodox religious people and the Israeli Palestinians, who have trouble identifying with the Israeli state and with the Israeli directives by the state, or especially with the Israeli army or the military in the current context. Those two groups were challenged, as happened before in the Lebanon war in 2006 for the Israeli Palestinians, and in other events of terror attacks by the ultra-Orthodox. They were challenged and pushed into the mainstream of Israeli society in the sense that they are connected to the center. And there was a lot of talk around the ultra-Orthodox community and its connection to the larger Israeli society, because the pandemic hit ultra-Orthodox communities the hardest in Jerusalem and in Bnei Brak and other locales where the ultra-Orthodox are a majority. And the fact that religious practices made them vulnerable, and they needed the help, some places, of the Israeli army or the help of the Israeli government, might change the relations between the groups for the long run. I can mention the effort by the Israel president, Reuven Rubi Rivlin, to make connections between the tribes, which otherwise are in a conflict situation. And a crisis like that has the potential to separate the tribes, and on the other hand, to make them realize that the joint life makes them vulnerable together. And I think the potential for closing the gaps between the tribes is higher than the separation right now in Israel.
Thank you. Asaf.
Yes, thank you very much. Uri, I think that I'm not sharing the idea on the decline of the state as a framework of control or governance, as well as a framework of redistribution and welfare. I don't think.
No, this is what I was trying to hint. I just said that you might, in regular times, you might have the impression as if the state lost something of its importance, or but maybe in fact these days we see that it was nothing but an illusion or wishful thinking, maybe, for some.
I think that you may be right that what we see in this crisis, that the imagination of states' retraction or reduction or decline is, as you mentioned, a mere illusion. The state proved itself when looking at the reaction of different countries, the economic, political reaction to this crisis. The state proves itself as the main, the most important platform for protection, but mainly for the redistribution of resources and wealth, and the creation of welfare and protection for citizens against external danger. It's important to note that in the face of these unprecedented crisis, we do see a movement in economic ideology back from the somewhat neoliberal free market ideology or austerity-based monetarist policies to expansionary fiscal policies, recognizing and amplifying the main role of the state in creating economic demand. But in Israel, and to some extent also in the United States, but in different manners, we see that the conservative free market ideas still dominate, and therefore making it very hard for the state to create and expand the safety net for its citizen. And while economists throughout the world speaking on printing money and coming back to a sort of Keynesian models, Netanyahu is still quoting Milton Friedman and his semi-libertarian ideas. But nonetheless, there is a potential for a change. Professor Yair mentioned his relative optimism towards a reintegration or increasing links between different groups in society. I think that what the health crisis in ultra-Orthodox communities proven or should prove to the Israeli societies is the unimaginable condition in which ultra-Orthodox communities live in Bnei Brak and in Jerusalem, very high density and low, very small houses and apartments that create a fertile ground for the spread of disease in this community. Let's hope that the new Minister of Housing, which comes from the ultra-Orthodox community, will tackle these problems in order to make this community, as well as other vulnerable communities, more resilient to these kinds of crises. And as you mentioned, the role of civil society, I think it still has place, though the weakness of civil society in Israel and its dependence on state resources as well as external funds is in its making it very difficult for them to challenge the state policies, and therefore relatively narrow ground to promote radical or significant political change in the state's perception policies, as well as new solidarities. But let's hope for the best.
All right, so we have some time for questions from our audience. So far, we have only 2 of them, so we want to invite you. We'll probably will be able to take another one or 2. But the first questions that was presented, I hope that any of you will be able to say something about it. I wouldn't be able, I must admit. And the question is, how is the kosher meat industry in Israel handling the pandemic? And are there or have there been any problems as we can see in the US? Who are the workers in these plants? Does any of you would like to comment on that?
Yeah, with pleasure. Actually, I studied a little bit this industry, and I had the privilege of also working with organizing workers in this industry in Israel. And to my great surprise, there were hardly any cases of coronavirus disease in this industry, while they continued to work as normal, they tackled very, very low problems. And it must be emphasized, the workers in this industry are ultra-Orthodox as well as Israeli Palestinians. These are the workers in the kosher meat industry in Israel. You could see very low level of coronavirus cases in this industry due to very harsh protection from both the ultra-Orthodox butchers and the employers' maintenance of health and safety regulations, because its essential role in Israeli society in the supply of food.
All right. Gad, would you like to add anything on that?
Not on that point. I can take the other questions about the NGOs.
All right. So the other question brings us back to what we already opened, and it reads like this: Civil leadership, an umbrella organization for third sector, had a recent report saying that over 1/3 of NGOs not sure they will survive in the economic wake of the pandemic. So what is the role of the Israeli government to respond to fill this gap?
Well, I would say that the question identifies a real problem or a real challenge for NGOs. In the latest meeting I had it with one of the NGOs, the question was about the funding. And there were efforts made during March and April to get funding by private sector companies who usually contribute money to the NGOs, and it was basically impossible to raise money at that point. And I guess this is going to continue to be a challenge for NGOs. And just as companies will disappear, some companies will disappear from the scene. We will see NGOs disappearing because of their inability to get funding from private sectors. That will increase the dependencies of NGOs on the government. And those NGOs who succeed to replace government actions and basically become part of the government in a unique collaboration, those are the NGOs which will survive. Those who are fully dependent on private sector investments are likely to have great challenges right now.
All right. So the next question is that the press writes our participant. The press has portrayed the Haredi community as ignoring or willfully violating the quarantine orders. How do you explain the relatively low numbers of cases of infection and death in this community?
Well, the numbers are not low in the ultra-Orthodox community. The ultra-Orthodox community took the largest share of infections. We don't know about death, but surely the communal practices that Judaism practices, you have to sit in a minyan every day, you have to go to the yeshiva every day, you have large families, and a very strong familistic bondage across generations. So young people meet old people on a daily basis. That which normally serves the community as a social capital that is a safeguard against hardships. In the current crisis, those very features were the challenges that the community faced. And indeed, it took some time until the ultra-Orthodox leadership listened to governmental directives and acted on them. I think it took 2 or 3 weeks until the ultra-Orthodox communities got on board with the governmental action to close Israel down and to curb the pandemic.
Mm-hmm. If I may, I think the Israeli media has a somewhat weird hobby to regard the ultra-Orthodox Jewish community as disobedient and defying regulations. But when you look on pictures from the beach of Tel Aviv and as well as other open public parks, you see secular people running around and having fun on the beach or on the or in the parks like nothing happened. The somewhat exotic image of the ultra-Orthodox people as defying the logic of the secular state is nonetheless attracting more attention. But when you look at the high numbers of sick people in this community, it's very hard to ignore the very difficult conditions which created them. It's both the preliminary neglect or ignorance of the ultra-Orthodox leadership, but mainly the fact that Bnei Brak and the ultra-Orthodox community in Jerusalem are among the most densely populated and poor communities and regions in Israel, which create, again, a fertile ground for the coronavirus to spread.
All right. So
I would like to offer a rebuttal, if I can.
Yes, shortly.
Yeah, so I followed some of the rabbis, you know, many of them are online now, and they were speaking as early as December about the pandemic, and they were asked by their audiences about precautions, whether they should take ones. And there were several answers which, were baffling for a secular mind. Like, if you pray daily, then the pandemic will not hit you. If you make 20 blessings a day, the pandemic will not hit you. Kosher practices mean that the pandemic will not hit you. So many rabbis made their communities vulnerable by continuing their trust in God, and nothing will happen to us. And in the case of the pandemic, you may trust God, but it's also smart to follow the directives of the CDC in the case of the US, or the medical administration in Israel.
All right, guys, so we almost ran out of time, and we have no further questions from the crowd. Or maybe do we? Let's take a quick look. Yeah, there is one. Sorry for sticking my face to the screen because I hardly can see it. So the question runs like that, and please, it would take a very, very short answer. Do you see the pandemic as closing the social gap between the secular and ultra-Orthodox Israeli community, and why? And I think, in a way, you both gave an answer for that. Do any of you would like to add any final word about that?
Yeah, I think the people will maintain more openness to alternative media and the internet, so as to get answer for questions. So ultra-Orthodox people will not listen only to the rabbis from now on, will also listen to other sources of information. So I think the democratization that happens here will make the gaps between the groups smaller for the long run.
So you say Rabbi Google will be introduced to the Haredi community.
Indeed.
Last, yeah. Asaf, any last comment about that?
I think that without a very brave and intensive state engagement with, we can call it detached communities or defiant communities, we cannot expect any narrowing of gaps and inequalities. But as is characterizing the Israeli state and government since its establishment in 1948, they allocate very little resources in order to narrow these gaps. So one should not expect any change not in the population's behavior, neither in this horrible and to some extent deadly inequality.
I see. All right, guys, I'd like to thank you very much, Professor Gad Yair, Dr. Asaf Bondi, for joining us today. It was a fascinating discussion, very illuminating, and I believe that we all had great pleasure and learned a lot. I want to thank the Nazarian Center team for enabling this event. I want to thank all of you who managed to join us today, and to urge you to keep following us and be tuned to our coming events. We'll be more than happy to have you with us in the future. Thank you so much, and let's hope we'll all be, beyond this crisis very, very soon. Cheers. Yeah, man. Take care and keep safe.
Bye-bye.
Bye-bye.